What's up, everyone? Welcome back to another day of our review session for the NCLEX. Welcome to our 60-second session, and we are almost through with our 90 days of free NCLEX review training. And for those who are new to the channel, you're welcome as well to join us. And we're encouraging you to enroll into our NCLEX course via www.stancoastnclexcoaching.com. We are offering that with that subscription that is available for about 6 months, and you will have access to the 20 hours of animated videos plus the 200 hours of on-demand recorded videos plus the 3,000 NCLEX questions and 200 NGN test questions. And again, that's something that you can access for the entire 6 months, 24/7. And yeah, kindly hit the like button and also subscribe button if you haven't done that yet, and also share this to your friends who are also reviewing for the NCLEX. Now today we will be continuing our discussion on the neurological concepts, and we'll specifically talk about the tic douloureux or the trigeminal neuralgia. So let's head into the discussion this time. So what is this disorder? Well, basically this is the tic douloureux, which is the other name of the trigeminal neuralgia, and this is a chronic pain that is characterized by sudden and also intense facial pain. And this is also going to affect the fifth intracranial, or the fifth cranial nerve rather, and this is that nerve that is responsible for the transmission of the sensations from the face to the brain. Now, this disorder is described as one of the most severe pains known, and frequently involving with that sharp electric shock-like pain that can affect the lower face and also the jaw and the other areas around the nose and eyes as well. Now, this is something that can primarily affect in one side of the face, and in some cases, though, there are some rare cases where it can affect both sides of the face, but most often, this is going to affect just one side of the face. Now, let's take a look here, the different causes and the types of trigeminal neuralgia. And so we will divide them into the three types and the causes. So the first one is what we refer to as the classic TN, and this is the most common form that is resulting from the vascular compression of the trigeminal nerve. Please take note, this is caused by the compression of the trigeminal nerve root caused by a blood vessel. So it is going to cause some impingement, and the blood vessel will typically press on the nerve at the base of the brain. Again, this is caused by the superior cerebellar artery. Okay, so that blood vessel causing that compression is the superior cerebellar artery. Just wondering why my pen is not working today. Superior cerebellar artery, and this will impinge the nerve, which is basically the trigeminal nerve root. Now, the constant pulsation of that artery, the specific cerebellar artery, with that pulsation, it can cause that erratic and hyperactive nerve signaling that will trigger the pain. Okay, please take note of that. Now, we also have the secondary type of trigeminal neuralgia. So what is this? This is caused or will be as a result, as a secondary to the multiple sclerosis, and it can also be caused by the tumors or maybe cyst, or it could be the AV malformations, those arteriovenous malformations, which can also damage the myelin sheath protecting the nerve. So take note, guys, that the trigeminal nerve roots myelin sheath is also impaired, and it's going to be damaged as well by these secondary causes like the MS, we have the tumors, and the AV malformations. So take note of that. The myelin sheath. So there is such kind of a demyelination going on into the trigeminal nerve caused by these secondary contributory factors. Now, again, guys, please take note. We had mentioned about the multiple sclerosis, and this is going to cause more of a bilateral pain, so affecting both sides of the face. And for those people that may have the trigeminal neuralgia, ages less than 40, they need to be evaluated for multiple sclerosis because this is closely associated to the MS, especially if they had the trigeminal neuralgia before age 40. So please take note of that. Now, another type of the trigeminal neuralgia is what we call as the idiopathic, wherein there's no discernible cause that can be found even after several diagnostic tests have been completed. Again, it is totally unknown. Now, take note here that the trigeminal neuralgia is going to affect lots of people, and this is going to occur in about 150,000 of people every year. And this is going to occur mostly in people over 50 years old, and this is occurring more, twice in women compared to men. All right, please take note about the incidence. 150,000 people every year. It affects more on adults, especially greater than 50 years old, and it occurs twice as much in women compared to men. Again, please take note about the incidence of the multiple sclerosis as well if they are age less than 40. Now let's move along with the review of the trigeminal nerve. Before we are going to go through the different manifestations, we really need to refamiliarize about the function of the trigeminal nerve, which is basically the cranial nerve number 5, right? So it has so many branches. There's actually 3 of them. We have the ophthalmic branch, and please take note about the innervation of the ophthalmic branch. Take a look into that one. This is the first branch of the trigeminal nerve, and it is responsible for the sensation in the upper part of the face. So take a look here. It's going to control the sensation. It will transmit the sensation coming from the eye itself. Also, it will help in the blinking. It will aid in the blinking process or the reflex. Now, it also has a function with regards to the upper eyelid. Okay, so let me put it right here. Blinking. Actually, I think I have it right here. There you go. So we have the different branches here. The first one is the ophthalmic branch of the trigeminal nerve. It is going to control the sensation. It will facilitate in the transmission of the sensation coming from the upper part of the face. And again, it will help in the blinking of the eyes, lids, upper lids, and also the forehead. It will relay those sensations like touch, also the temperature coming from the forehead, and it will also transmit the sensory information from the upper eyelids. Okay, so these are the functions of the ophthalmic nerve, which is a major branch of the trigeminal nerve. Now, what do you think can happen, especially in the patient has the tic douloureux or the tic douloureux? So what do you think are those manifestations if they will have this disorder? Well, the patient here will experience the stabbing, it's severe pain, that burning sensation in the forehead or the eye region. And this is going to be triggered by so many activities, maybe brushing the forehead or exposure to the wind, or let's say draft exposure, or touching the forehead. So those are the triggering factors causing the severe stabbing pain into the forehead area or the upper part of the face. Now let's move forward into the second branch of the trigeminal nerve, which is the maxillary nerve. What is this? The function of the maxillary nerve basically is going to carry those sensations from the lower lids of the eyes, okay? It will also provide sensation. It will interpret the sensation from the cheeks. And also, it can convey sensations coming from the nostrils. It will also contribute to the smell detection. And the maxillary nerve is also responsible in the sensation in the upper lip and also the upper gums, which is important for the eating and also speaking. However, when the person has the trigeminal neuralgia, this is going to affect the maxillary branch and they're going to experience that electric shock sensations. Whoops, the letter C right there. Electric shock sensations affecting the cheeks, the nostrils, the upper lip, and gums. So these areas are actually going to be where the sites of the pain is. That electric shock sensation, sharp pain. Now let's move forward into the next branch of the trigeminal nerve, which is the mandibular section or branch. This is going to affect both the sensory and the motor function. And this is going to control those areas, specifically the jaw, which will provide sensation to that part. And this is going to be affecting the functions of, let's say, the chewing. Now, other function here is to cause motor function into the lower lip and also the lower gum. So here the sensation is being carried from the lower lip and also the lower gums, and it will facilitate in sending those oral sensations as well. Now, like I've said earlier, it will also have a function with the control of the muscles, the motor function here. And so the person will have, will be influenced by this mandibular nerve, especially the chewing, the mastication process. So take note about that mandibular nerve function. However, if the person has that trigeminal neuralgia, they are going to experience that intense pain in the jaw, also the lower lip, also the lower gums, and it can interfere with eating and speaking. So please take note about the involvement of the mandibular nerve. Interference in eating, chewing. So the patient here, because of the chronic intense pain that they're going to be experiencing whenever there is stimulation of this nerve, this can potentially affect their intake and also their speaking. So most often this person will be somewhat kind of aloof. It will not be so conversant. They will not be able to maintain their oral nutrition intake of food because of the fear that the pain will come on immediately. So what can trigger the mandibular nerve pain? Well, this is going to be triggered by the chewing and also brushing of the teeth. Tooth brushing. Hello everyone. For those who are new to our review session, welcome. I hope that you will stay with us throughout the duration of this session today. Now again, let's recap the functions of those different branches. Again, we have the ophthalmic, maxillary, and the mandibular nerves. These are going to be involved in the tic douloureux or the trigeminal neuralgia. So again, the trigeminal nerve is essential in the sensation in the face, and also it is important for the motor function, especially the mastication. Now, each branch will serve its own function into a specific area of the face. It will send messages for the sensation. It will also help us in interacting with the environment. It can also feel temperature. It can be involved in sending the sensation of pain, even light touch. And also, it can protect the person from any different events. So that sensation is really important for us as a protective mechanism as well. Now, when the person will have the trigeminal neuralgia, these functions are going to be disrupted. So imagine about the nutrition, about the patient. It can also affect their ADLs. They probably would not be motivated to doing a lot of self-care activities, because even brushing the teeth, chewing, even combing the hair, even the presence of that draft can actually stimulate that pain sensation. And so those even the normal daily activities can really trigger those pain sensation. Now let's move right along into the symptoms of the tic douloureux or the trigeminal neuralgia. So we are going to classify those symptoms according to the different types here. So if we're going to talk about the type 1 TN, the person will have the intermittent episodes of the sudden, severe, and shock-like pain. And this will commonly affect those areas innervated by the trigeminal neuralgia, and commonly will have a duration about seconds, few seconds, about to 2 minutes. So this is the duration during the attack. Please take note. During the attack, it can last for about few seconds to about 2 minutes. Imagine, that's already quite long for this patient to feel that sudden shock-like pain in their face. And again, it can cause their pain in the forehead, the eyes, the lips, also the nose, the jaw, and also the scalp. Now, the person will also manifest this involuntary twitching. Please take note about the twitching. This is another painful, what do you call this? Muscle activity. This is quite intense. And again, this is the hallmark in tic douloureux, the involuntary twitching. Now, when we are going to talk about the entire episode of the attack, it can last even for several days, and it probably will be interspersed with days with no manifestations, and it comes back again. And again, the entire episode can last for about several hours to several days. So imagine with this kind of painful experience. Now let's move forward to the second type here. So it's going to involve the forehead, eyes, lips, the nose, and also the jaw, and also the scalp. Remember about those 3 branches of the trigeminal nerve. Now, talking about the type 2 TN, this is going to cause much more constant. Take note of the clue. It is constant aching. It will manifest as a burning pain, which is known to be less intense compared to the type 1 trigeminal neuralgia. Okay? So that's the huge difference between the two. Type 1 has intermittent episodes of shock-like, sudden pain. Or however, when you are talking about the type 2, this is going to be constant, burning, achy pain, and is less intense. Now, what do you think are the triggers of the type 2 TN? There's many triggers as well. It could be the light touch. It could be washing the face. Imagine, you can't even really complete the washing of the face because the pain comes on. Shaving is another one. Shaving of the face, applying makeup, that is another aggravating factor. What else? Eating, even drinking, talking. So there's so many precipitating factors that can really cause the type 2 pain. drinking, talking, and also exposure to cold air. All right, take note of those. And according to the studies, the pain is going to occur seldom during sleep. So mostly this will occur, the manifestations of pain mostly happen during the daytime when the patient is more active, and there's chances that there's excessive stimulation to the nerves during the daytime, or whenever the patient is awake, I should say. Now let's talk about the different diagnostic tests in determining this disorder. Please take note that there are no specific tests that will diagnose the condition. It will be dependent into the comprehensive clinical evaluation and also the neurological assessment by the medical provider. And this is also dependent on how the person or the medical provider is able to obtain such thorough medical history, and also the gathering of those manifestations, the signs and symptoms, the type, the location, and also the triggers of the pain. So again, the comprehensive clinical assessment will be dependent upon the history of the patient, the signs and symptoms, the type, and also the location and the triggering factors. So these are the things that should be asked into our patient whenever they will be asking for help, maybe in the clinical or the medical provider's clinic, or it could be in the AD because of the intense pain. Another assessment or diagnostic test will be through the imaging studies. And this is going to involve the use of the MRI, magnetic resonance imaging. And this is really to help out in ruling out the other potential conditions, other causes. It could be tumors, or it could be MS, or it could be the vascular abnormalities that will lead to the compression of the trigeminal nerve root. Now, we know that the MRI really is the only identified diagnostic test that will clarify, or it will differentiate the tic douloureux from other conditions. It will reveal mostly about the nerve compression. So please take note about its significance. It will reveal the nerve compression, especially the artery causing compression into the trigeminal nerve. Okay. Now, there's also going to be ruling out of other conditions, maybe temporal tendinitis, occipital neuralgia, and so many others. But again, I'm not going to elaborate on those. So let's proceed into the treatments of this patient with a trigeminal neuralgia. We'll start with the non-surgical treatments. So we will be talking about medications mostly. And the medications here will include the administration of the anticonvulsants. These are those medications that will be primarily used in managing the tic douloureux or the trigeminal neuralgia. So guys, I want you to refamiliarize into that medication, which is primarily the carbamazepine. This is the first choice in the treatment of the trigeminal neuralgia. It is known to be more effective and also helping in the confirmation of the trigeminal neuralgia diagnosis. However, the use of the carbamazepine is going to be, the effectiveness of the drug seems to diminish over time, and there are also more side effects or adverse effects that can also probably lead to non-compliance by the patient because of the adverse reactions that they might be getting from the medication. Now, what is really the drug action of the carbamazepine, if you don't know about that? Well, the carbamazepine is known to calm down those overactive nerve signals in the brain, and it does block those channels in the nerve cells that are supposed to transmit those pain signals. And so this medication will really be effective in reducing the painful episodes, especially in this patient with a TN. Now, we will talk about the adverse reaction of the carbamazepine. What are those common adverse reactions? Well, these are the following. Part of that would be the drowsiness and the dizziness. The D's. They will also experience the nausea, vomiting, some incoordination. They will have issues with ataxia. Take note about the patient's balance. And imagine if you are the person taking this drug and you won't be able to really be safe. You don't feel a lot safer this time because of your incoordination when you are walking. So, yeah, imagine that. And also the hyponatremia, which is a big deal. Low sodium level. And there are so many manifestations that can be coming out if the patient has hyponatremia, like confusion. Low sodium can lead to confusion. And in severe cases, when the patient's sodium level is really low, less than 120 milliequivalents per liter, it can lead to seizures. Yeah. Now, other than the hyponatremia, the carbamazepine also can lead to blood disorders. And this is what we call as the low blood counts, right? The patient will be fatigued. There is pancytopenia. I will not probably use the pancytopenia word here, but there will be a reduction in the cell counts. They will be prone to infection. All right, blood disorders instead. Prone to infections, wherein the white blood cell count will be decreased. Okay, there's going to be anemia as well because of the reduction in the red blood cell count. They will get fatigue. And in some cases, they will develop the skin reactions. Severe skin reactions known as the Stevens-Johnson syndrome, SJS. It can also affect the liver, causing that liver damage. So again, guys, what would be your nursing responsibility here before we're gonna start administering the medication to this patient? Well, of course, regarding the adverse effect to the liver, we make sure that there is baseline LFTs, right? And there will be what do you call this, routine checking of the LFTs as well in order to evaluate the function of the patient's liver once they are already taking the drug. We also need to follow through in the complete blood count values, because as we know, this can cause lowering of the white blood cell count. It can also lead to the anemia, that fatigue, the risk of infection. So make sure that you have that as well. What else? Electrolyte count is important, especially when the patient goes into hyponatremic episodes. Make sure that we are monitoring that, and we will be replacing that electrolyte as well as needed and as prescribed. What else? We're going to have to make sure we have baseline neurological assessment, right? As we know that the drug can affect the patient's neurofunction. It can lead to ataxia, the balance. We're going to monitor if they have more incidences of like falls at home. That is very important. If they are getting more unsteady, if they get more dizzy at home, then make sure that we are promoting more education to this patient. They need to be cautious, especially when ambulating. So they might need to use some assistive devices around this time, or they might need some physical assistance when they are getting up from their bed as well, or when they are toileting. So please take note about those nursing implications with this drug. Now let's move forward into the next medication, which is the oxcarbazepine, which is similar to the carbamazepine, and it has also that function to reduce the pain signals. It can block the electrical activity in those overactive nerve cells. And eventually this can prevent the nerves from sending those painful stimuli or painful sensations. And this is actually a newer medication. I mean, it's not really that new, but this is more widely used now compared to the carbamazepine because of having fewer side effects compared to the carbamazepine. So this is now considered as the drug of choice this time in the treatment of the trigeminal neuralgia. Fewer side effects. Okay? Take note about the adverse effects of the carbamazepine. Those are plenty, right? Now, the patient may also manifest the dizziness, the sleepiness, the nausea, vomiting, double vision, hyponatremia in the oxcarbazepine. Those are manageable. However, it will not lead to the lowering of the complete blood count, the cell counts, and the other impairment, especially the liver impairment. So fewer side effects for this oxcarbazepine. Now, another medication that is in the family of anticonvulsants is the gabapentin. Gabapentin or the Neurontin. So the role of the drug is also to quiet down the nerve activity. It will affect the way how the nerves will communicate with each other, and it can also reduce the pain by decreasing the release of certain chemicals that excite the nerves. So that's the GABA aminobutyric acid. Remember that neurotransmitter. Please take note, guys, that the gabapentin also has some adverse effects, and these are things that you really need to include in the education to your patient before they are going to start taking the medication. So what are the adverse effects of the gabapentin? Now let's talk about that. Gabapentin adverse effects. So they will also experience the dizziness, drowsiness. They're also going to have the peripheral edema. And this will affect both the arms and also the legs. Arms, legs. With that, they're going to have some weight gain as well. Weight gain. And this is caused by the increasing appetite. All right, weight gain, peripheral edema, dizziness, and drowsiness. So don't forget about those adverse effects of the drug. Now, there's more. This gabapentin can also lead to respiratory depression. Patient will become bradypneic, especially when this is used together with other sedatives. So respiratory depression and also some changes in their mood. And in some patients, they might also develop those suicidal thoughts as well. So please take note. So before starting this medication to your patients, make sure that you have done your thorough evaluation or assessment about their neurological function. Also, cardiovascular check. Take note if there is an existing edema going on in the extremities, and then you're going to have to monitor if there is going to an onset of those edema. What else? The patient's mental status as well, their mental health. If they might have a pre-existing suicidal thoughts, that would be also needed. Something that you should report right away to the medical provider. Okay. Now let's talk about another drug in the family of the anticonvulsants that will also be used in the trigeminal neuralgia. We have the pregabalin. This is going to work in calming those nerves. It will also reduce the release of the pain-inducing chemicals. and this will overall reduce the nerve pain that is felt in this patient. Now, talking about the different adverse effects of the pregabalin, they will experience the same set of the adverse effects, the drowsiness, dizziness. They will also encounter the edema. They will experience that. But what would typically develop in this patient would be the angioedema. This is life-threatening. This is a much more severe form of swelling. And the angioedema, as we know, it can affect the throat and also the patient's face. Now, another is the muscle damage, breakdown of their skeletal muscle, or known as the rhabdomyolysis. This is going to cause the breakdown of the muscle fibers, and those contents will be filtered through the kidney, and it can lead to the renal failure. So please take note about the rhabdomyolysis as an adverse effect to the pregabalin. Now, we are not done yet. We still have one more anticonvulsant medication that will be potentially be ordered for this patient with the tic douloureux, and that is the lamotrigine, another anticonvulsant drug, and it has that specific effect to stabilize the nerve activity. It can block those signals that can cause excessive firing of the nerves, and it can also help reduce the pain from the trigeminal neuralgia. Now, talking about the side effects, they will have similar, or adverse effects rather, they will have similar adverse effects with the other anticonvulsants, those drowsiness, dizziness, but typical to the lamotrigine will be the skin rash. Take note about the skin rash. This is going to be probably a mild type of rash, which can eventually will become serious, and you should report this to the medical provider, as this is what we call as the Stevens-Johnson syndrome, the SJS. These are life-threatening rashes. So take note about that adverse effect from the lamotrigine. What else? The patient will also possibly going to have that meningitis-like symptoms, which is a rare inflammation of the brain and also the spinal cord as a result to this medication. Actually, there's one more drug here. We have the Topamax or the topiramate, another anticonvulsant medication. So recall what I have discussed back in our patient who had a seizure in previous lectures that we had. The Topamax or the topiramate will also help calm those overactive nerves, and it can influence those different chemical signals in the brain, helping to reduce those nerve-related pain. However, with a Topamax, it also will lead to so many adverse effects, and one of those will be cognitive effects, wherein they will get confused, they will have difficulty in concentrating, and so this is going to be a challenge, especially for those adults that are still working, right? This can really interfere their daily life. And aside from the cognitive effect, this can also lead to those tingling sensations that often will be felt in their hands, the feet. They will also have the weight loss, which is caused by the anorexia. So let me have those cognitive effects, weight loss, and tingling sensation. Tingling sensation, weight loss related to the anorexia. Okay. So that would be it. There's so much more, but those are the commonly used anticonvulsant drugs in the treatment of the tic douloureux. Now, guys, we're going to talk about the phenytoin slightly here. That's also part of the treatment, but It has a similar effect with the other anticonvulsants, but here with the Dilantin, this is going to cause more of blood cell problems. There's going to be reduction of the white blood cells as well. It can also impair the liver and the severe skin reactions, which is going to be the Stevens-Johnson syndrome, okay, SJS, liver impairment. What else? Since we are talking about phenytoin, Dilantin, remember about the gingival hyperplasia. Yeah, that's the one. That is a very common adverse effect of the drug. They might also have involuntary eye movements. So take note of those. And hirsutism in women. Excessive hair growth in those unusual places, especially the face, could be the neck area. So take note about the anticonvulsant effect. Now we also have the baclofen, which is that muscle relaxant, which will be helpful in lessening or decreasing the pain sensation in this patient with the acute tic-douloureux pain. Another is the botulinum toxin injection, or the Botox. However, this is going to be only used when the other measures, other pharmacological agents are ineffective, or if they're not going to be able to tolerate those adverse effects, then this will be the option, the Botox injection. And we also have the antidepressants, such as the TCAs. We have here the Elavil, amitriptyline, or the nortriptyline. They are going to be beneficial into the type 2 tic-douloureux, or the trigeminal neuralgia. Okay, now when the patient will be taking the antidepressant drugs, especially if they will be given higher doses, then this is something that you should educate about. Especially when the doses are higher for this patient, they will have impairment in their vision. There's going to be diplopia, drowsiness as well, and in severe cases, liver and kidney toxicity, hepatic and renal toxicity. And make sure, guys, that you also have to monitor the patient's blood cell counts, the CBC. Okay, that is very important. Alrighty, so here we are going to talk about this different surgical treatments if the patient will not be responding well to those drugs that we had talked about, or if those medications will fail, or if the patient is not able to tolerate those side effects or even the adverse reaction. So we're going to divide this into the more invasive type and the less invasive type. And so for the open cranial surgery, this is the most effective surgical procedure for the patient with a TN. And the purpose of this procedure is basically to relieve the nerve compression. That is the primary purpose. Relieve compression of the trigeminal nerve. So that is the goal. Relieve compression of compression. Wait a second. Of the trigeminal nerve root, or the TNR. So how are they going to do this? Well, the patient will be getting this invasive procedure. It will require signing of the consent, extensive discussion about the risk and the benefits by the medical provider or the surgeon. Make sure that they fully understand the purpose of the procedure and the complications, what the steps involved in the procedure as well. And this is a procedure that will require craniotomy. It has so many risks involved. It will require craniotomy. So those are the risks that I'll be talking about. We are going to educate the patient about the possible hearing loss. These are the risks. What else? There's going to be facial weakness. As we know, that the procedure will involve the manual decompression of the nerve. And in some cases, there will be stroke. So there are so many things that are involved here. However, this is a surgical procedure that is much more preferred for long-term relief. They said that the procedure will involve, or it cannot really affect the sensation. It doesn't cause facial numbness. That's what it said in the literature. So again, the specific name of the open cranial surgery is the microvascular decompression surgery. This is the MVD. And so it involves the craniotomy procedure. And in here, the patient will be receiving the general anesthesia. They're going to be on the operating table, and they're going to do the craniotomy or craniectomy, and they're going to get that incision. They're going to have to form that incision behind the ear, and the skin, the muscles will be lifted, folded back, and then a tiny piece of the skull bone, about an inch in size, is going to be removed around this procedure. So let's take a look into the surgical site. So you will see here the blood vessel, superior cerebellar artery that is actually compressing into the trigeminal nerve root, which is basically the aggravating factor. It constantly, the pulsation of the superior cerebellar artery is actually causing the trigeminal nerve signs and symptoms. Imagine that, just the pulsation. So once the nerve is being exposed, let's go through the next right here. Once it is exposed, the nerve will actually going to be placed they're going to put this somewhat kind of like a Teflon type of sponge. So they will insert the sponge right here. You see that white sponge? It's not similar to the dry gauze. No, it's different. It is a Teflon sponge that will be placed between the trigeminal nerve and also the blood vessel. Okay, remember about that superior cerebellar artery. And the reason for placing that Teflon is to prevent the compression of the trigeminal nerve. It will serve as the cushion. It will prevent the blood vessel from pressing into the trigeminal nerve. And if you're going to ask, how come this will be placed into that tissue? Will it cause maceration of the nerve root? No. Like I've said, it's not similar to a regular gauze pad. It is a Teflon substance. It is a Teflon sponge that is designed to be biocompatible. It has fewer risk in causing tissue irritation, and also it has few risks in causing breakdown of the tissue. So it is an inert material that does not generally cause significant inflammatory response. So it will not cause significant tissue damage. Okay. Now, once that sponge or that Teflon sponge is placed between the blood vessel and the trigeminal nerve, they're going to place that metallic device. So this is going to include the positioning of the titanium plate. So this is the plate that will be placed on top of the burr hole. Okay. And this will be screwed in to secure that area. And then, of course, the closure of the skin and also the other layers of the tissue. So that would be our microvascular decompression. Again, the application of the Teflon sponge to prevent compression of the trigeminal nerve. Well, if you're going to ask, what happens after the surgery? Well, once they are waking up from the anesthesia, they're going to be sent to the recovery room and eventually will be moved into the ICU for overnight observation. And that's the common, what do you call this, direction of the care. And post-operatively, the patient will be feeling some nausea as well. They might have some headaches. This is something that can be treated symptomatically. And once the patient is more stable, they can be transferred to the regular med-surg unit. They can be advised to gradually increase their physical activity like sitting, walking, and in about 1 to 2 days, those patients are going to be discharged from the hospitals, of course, with the thorough home care instructions. So what do you think are those restrictions that might be advised for this patient that has the microvascular decompression or the MVD? Post-procedure. I'm not sure what's going on with my pen. That is weird. Let me restart my pen. So what are those restrictions that you should know about and what you should teach to your patient? Okay, so one of those will be, wait, let me go back. We're going to have the restriction in their lifting. What would be that restriction? Guys, the patient will not be allowed to lift heavy objects more than 5 pounds. So that is the restriction. Lifting no more than 5 pounds. And they will not be allowed to do strenuous activities, maybe yard work, housework, sexual activity immediately after the surgical procedure. Yeah, no bending. That's part of the care. Another is no consumption of alcohol this time. Why? The alcohol has an anticoagulant effect. It thins the blood. So for the first few weeks post-op, they're not supposed to be taking any alcoholic beverages because of its thinning effect, especially when they are taking it with the non-steroidal anti-inflammatory agents like aspirin. They're not supposed to do that as well because of the thinning effect. And the patient will be prone to bleeding if they're not going to observe those restrictions. Another is not allowed to smoke nicotine, cigarette smoking. Especially tobacco. This can delay the healing, the vasoconstrictive effect. They're not supposed to drive. They're not supposed to return to work right away. It will take a good few months or a week, not a week, but about a month before they can be cleared to go back to their work. And also, the incision care here is very important. They are somewhat allowed to shower after the surgical procedure, but making sure that the site is kept dry though. They should be covering that area to make sure that there is no, what do you call this? It will, to lessen the moisture rather. That's their goal, while we are going to teach them to make sure that they're covering that site. Make sure that they are going to have follow-up surgical or wound care to make sure that there is no ongoing infection, and also to monitor for any signs of infection. If there's any swelling. What is that, Jessica? I'm not understanding what you're typing. So can you please verify? Now, if the incision is being covered by like a glue-like substance to close the incision, then they are supposed to keep it intact. They should not be rubbing that area or picking on it, because this is a sealant that will prevent or that will promote rather the healing process of the incision. Okay, and they're not supposed to submerge themselves in the bathtub. No submersion in the pool. And they're not supposed to apply lotions as well, ointments, hair styling products over that incision site, because this can cause some changes into or it can prevent the speedy recovery or healing into that incision. Okay. Now let's talk about another treatment, which is surgical in nature, for the treatment of the TN. So this is another lesioning procedure. So what is this? The patient will undergo this procedure, what we call as the radiofrequency rhizotomy. What is this? Frequency rhizotomy. This is a minimally invasive type of surgical procedure that is also going to relieve the pain in the TN. So what is involved here? Well, of course, as you see in the photo, there is the insertion of that instrument or the needle. Especially, it is going to involve the injection of that numbing material into the specific branch of the trigeminal nerve using that radio frequency. Or they're going to have to also administer the electrical currents to selectively block those nerve fibers, okay? And this will lessen the pain sensation as well in this patient. Now, it's said that the procedure can alleviate about 95% of all cases in the TN. It can provide long-lasting relief. And this is something that would be suitable for those patients that have MS, okay? More suitable in patients with MS. And for those patients that are not candidate to getting the cranial surgery, which is much more extensive, or those patients that are experiencing pain recurrence after the other treatments, so they are not going to actually this is a procedure that will benefit them all the more. So what is involved here in the radiofrequency rhizotomy? Before they're going to have this invasive procedure, they're going to have evaluation, of course, with the imaging study. They're going to have the X-ray and also the CT scan of the brain. And this procedure is going to be done under sedation, or it could be general anesthesia. Of course, patient will be placed on NPO, general anesthesia. What is going on with my writing? General anesthesia. And the patient will be in the sleep mode this time. They're going to have to create that small incision in the cheek area. And a radio frequency through the insertion of the needle is going to be advanced into that specific area of the trigeminal nerve. And they're going to have to position the needle in order to apply that electrical stimulation to accurately target the specific nerve fibers that is causing the pain. All right, so what are we going to do here as nurses? After the procedure has been completed, well, of course, we're going to have to check the patient's vital signs. We're going to have to monitor the patient post-recovery or during the recovery phase. Another is the pain management. Patient will experience some discomfort after the surgical procedure. They will have some mild facial numbness. This is something that we will be able to treat symptomatically if they're going to be having that pain. A Tylenol or acetaminophen can be given as ordered. And as far as the restrictions post-procedure, what are those restrictions? Well, they are recommended to have rest and avoid strenuous activity for a few days after the procedure. They are going to be able to resume work after a week of rest. Avoid strenuous activity for 1 week. Now, what do you expect, especially that this is going to involve the insertion of that needle? Well, the patient will have that residual swelling, mild swelling of the face or the cheek. And part of the care here is to let them know, educate them that this swelling is going to be expected in the cheek area. It is considered normal. However, if there is going to be worsening of the swelling, then that's something that would prompt them to make that call to the medical provider. It could be now an infection. So for the mild swelling, what we can instruct to the patient here will be to advise them to apply ice packs to the area to reduce the swelling. And again, a follow-up within that time frame could be a week after the procedure. Then they need to show up for that appointment, make sure that the medical provider is able to evaluate the overall effect of this treatment. Now, what do you think are those other side effects other than the mild swelling? Then please take note, guys, since we are going to anticipate the insertion of the needle and also application of the radio frequency into that facial nerve. This is going to cause some numbness. So this is going to be a expected finding initially, numbness. That is common. However, if they're gonna experience excessive numbness, if there is going to be a much more of a extensive numbness all throughout the face that is beyond the expected numbness, then that is something that should be reported to the medical provider. So excessive numbness should be reported to the doctor if the numbness will worsen. Okay, guys. Now, other than that, numbness, mild swelling in the face, they might also have incomplete pain relief. So if there is worsening of the pain and that is not relieved by those prescribed pain medications, then this should be reported as well to the medical provider. This could be a much worse type of complication that has happened to this patient. Now let's talk about the next procedure here, another lesioning procedure. So this is what we call as the balloon compression. So what is this balloon compression? This is going to involve the insertion of that balloon to treat the trigeminal neuralgia. It is going to be performed under general anesthesia as well. Patient will be NPO prior to the procedure. Make sure that the consent is also signed and they understood the risk and the benefits of the procedure. And so the patient here will get the small incision. And the incision is actually created near the corner of the mouth. And the creation of that incision is done because this is the entry point of the balloon, that small balloon that will be threaded into the face of the patient, and it will be positioned near the trigeminal ganglion. And then the balloon, which is this one right here, that is already inflated. This will be inflated as soon as it is carefully advanced into the section where there is a compression. Okay, so that balloon will actually prevent, or it will be inflated about 1 minute in order to compress and slightly damage the ganglion. Again, the purpose of the balloon compression is to compress. It will slightly damage the ganglion and it will disrupt the transmission of the pain signals to the brain. So this is basically the site, the target site for the balloon. So the procedure itself is basically an alternative to the treatments such as the microvascular compression, and it is closely effective compared to the microvascular decompression as well. And it has a higher rate of facial numbness, so that's something that we should watch for as well. Now, they said in the literature that this is something that can treat about 90% of those patients, but they will have alleviation of the pain. But some patients said that about 20% of them may experience recurrence of the pain after about 2 years. So that is the drawback about this procedure. After 2 years of the balloon compression, they will have recurrence. Now, what about the side effect about the procedure? This will lead them to have that facial numbness, as we know that the procedure actually will target into the ganglion that is supposed to transmit those painful impulses. So it is expected that there will be facial numbness, but they would prefer the numbness over the severe pain, right? If I'm the patient, if I'm having the severe pain, the knife-like sensation, the throbbing pain, I would rather have the numbness over the painful sensation. Now, other than the facial numbness, they might also have infection of the site, since this is going to involve with a insertion of that device, and it's going to require the creation of that incision. And so make sure that we're also monitoring the patient's incision site. What else? This can also lead to some injury into the blood vessels, and this is known to be rare as well. Okay, guys, so what is our role here as nurses, especially post-procedure? After the surgery has been completed, we're going to monitor their vital signs, check in their neurofunction, make sure that they're stable. We're going to have to treat them, whatever pain, residual pain that they might have after they start waking up. We can instruct them into taking those prescriptions intended to control their pain after the surgical procedure. Now, as far as the restriction, it will require the patient to avoid strenuous activity for the first few days post-op, and they can gradually resume their activities after a week. Okay. Now, what would you expect other than the facial numbness and infection? They're also going to have some swelling, bruising of the face. Swelling, bruising of the face. And this is something that can diminish within a few days. But again, if there is worsening of the swelling, bruising, then this is something that they should report to the medical provider right away. And how are they going to treat this at home? Well, the use of ice packs will be beneficial as well. Like I've said, the application will require them to have that application several times a day, every 4 hours as needed, and no longer than 20 minutes for each application. And make sure that they're going to follow through with their medical appointment post-surgery. Now, the next lesioning procedure we have is the glycerol injection. So what is this glycerol injection? This is going to involve the insertion of that needle, and it will involve gathering the patient's consent, of course. There should be thorough explanation by the medical provider or the surgeon regarding the risk and the benefits. There's also a need for the pre-procedure imaging. Don't forget about the consent, the risk and benefits discussion, and this should be applicable in the other invasive procedures that I'd mentioned. Risk and the benefits discussion. And part of the care would be to have an initial imaging study, MRI, before the procedure. Now, this is a procedure that will require sedation and also anesthesia. They will either going to be given a light sedative or a light anesthesia, I should say. Sedation versus light anesthesia, in order that the patient will be somewhat, they will not be able to feel really the pain involved in the procedure. Okay, this will numb the area. Now, as you're going to see in this photo right here, it involves the insertion of a needle, and this is going to be positioned into the patient's, the patient will be positioned on their back, typically on their back in the operating room, right, or in the procedure room. And the needle will be positioned, inserted in through the skin, usually near the cheek, or it could be the jaw area. And this is going to be guided by the real-time X-ray. So this is not done with just doing it in a, what do you call this? They're not supposed to do this blindly, but this is going to be done with a real-time X-ray, okay, in order for them to have a much more precise placement of the needle. And after the needle has been advanced into that specific area, that glycerol, which is a viscous fluid, is going to be injected directly or around into the trigeminal nerve. Okay. The trigeminal nerve area will be numbed. It will cause the disruption of the nerve function. So the pain here will be greatly controlled. Now, once the procedure has been completed, once the needle is being withdrawn, then there should be application of the dressing as well in order to cover the area and prevent any infection, as that is part of the risk. Infection is one. Potentially the patient may have some hemorrhage or bleeding at the site of the injection. They might have some nerve damage to the trigeminal nerve and also the nearby structures, and they might also have some facial sensory changes as well, numbness, or they might also develop some allergic reaction from the glycerol. So these are things that you should know about, especially this is involving the injection of that substance, glycerol. Alrighty. Now, there are other complications that are involved in the injection of the glycerol, possibly the seizure, but they said that it's rarely happening. But after the procedure has been completed, we're going to have to observe the patient's immediate status, checking their vital signs, make sure that we are monitoring their level of consciousness, possible complications, bleeding, and we are going to treat them with those pain relievers once the pain comes back, surgical pain, I should say. Another thing is that we're going to have to apply cold compress into the site, to the affected area, to reduce the swelling. And the same with the other surgical procedure, there is also restriction of their activity. They're going to need to rest, avoid those strenuous activity for a few days, almost a week, and they should avoid driving as well, and avoid manipulating or operating those heavy machineries until they are fully recovered and until they have been cleared by their medical provider. Now, as we are going to expect possible drainage here, infection, we want to make sure that the dressing is monitored. We want to make sure that the dressing is applied. It should be changed. It should be kept clean and dry as instructed by the medical provider. And we're going to monitor for any signs of infection, redness, swelling, increasing pain in the insertion site, or any presence of those discharge, purulent discharge, and need to be reported to the medical provider. Of course, post-procedure, they need to go back into the medical provider's office for a follow-up appointment. Now, let's talk about the last modality of treatment here, which is what we call as the stereotactic radiosurgery. Let me move this photo right here. We are on page 1309. 1309. There you go. You can see that. Okay. So, stereotactic surgery. What is this? This is a non-invasive type procedure. It can also be used to target the trigeminal neuralgia area. Specifically to the trigeminal nerve, rather. It is going to apply the radiation. It will disrupt the pain. It will cause damage into the trigeminal neuralgia that is responsible to pass on the signals to the brain. And they said in the literature that it has about 70% success rate in treating the trigeminal neuralgia. It is well tolerated. There's no incision involved here. However, they said that there is some recurrence of the pain up to about half of the patient population who complain about the TN, and they might need some additional treatments after. So what's involved in this procedure with the stereotactic radiosurgery? Again, like I've said, no incisions involved. The patient will be placed in this gamma knife unit. So it's like similar to a MRI machine, but they're actually going to be placed in somewhat a supine position, and they're going to have that frameless type of radiology kind of procedure, radiosurgery type of procedure. And they're going to have to precisely scan the patient's head, and they're going to be wearing that face mask, a mask, actually, not just a face mask, but they're going to have some kind of like a guide in order to target that specific site where the trigeminal nerve is. And the patient will be positioned again in a supine position to make sure that they will target that particular area where they're going to apply that radiation. Now, this is going to really damage the trigeminal nerve. It will end up blocking the pain signals to the brain. Now, what are we going to expect here after the procedure has been completed? The patient will be able to resume their normal activities immediately after the procedure. Okay? It is non-invasive. So the patient will really feel the benefits within 2 days to about 6 weeks before they can really see some changes, or they can feel those changes after the treatment. So they will experience that change within 2 to 6 weeks. There will be lessening pain after the stereotactic surgery. And so, guys, I hope that you're able to capture all those needed information regarding the different modalities of treatment, the invasive surgery, the non-invasive procedure, including the glycerol injection, the radiofrequency, the pharmacological treatment, the precautions that you should observe, especially adverse reaction to the drug, the education that you should be providing to the patient. There's many of them. So if you want to get those things absorbed, so review this video. Now this time, guys, we will talk about the test. So here is the question. But before we're going to proceed with this test question, I want you to check into our website at www.stancoastandflexcoaching.com. We are encouraging you to enroll into our NCLEX course, and there you're going to be able to access our services, our on-demand videos, plus the animated video series, and also the NCLEX test questions, about 3,000 on top of the 200 NGN test questions. So kindly click the link below in the description box to know more about us. All right, guys. First question. A 58-year-old female patient presents to the clinic with complaints of sudden, severe facial pain that feels like an electric shock. The pain is localized to her right cheek and jaw, and she notes that it can be triggered by brushing her teeth or a light breeze. She describes the episodes as sporadic and lasting a few seconds. Given this presentation, which of the following characteristics and considerations are true for this patient with trigeminal neuralgia? Select all that apply. Is it A, the pain is usually bilateral and affects both sides of the face? B, trigeminal neuralgia is more common in women over 50 years old. C, the pain typically involves a ophthalmic branch of the trigeminal nerve. D, anticonvulsant medications are the first line of treatment for trigeminal neuralgia. E, an MRI can help identify if vascular compression is causing that trigeminal neuralgia. And letter F, the patient's condition is likely secondary to multiple sclerosis given her age and symptoms. All right, guys, testing your retention right now. So please put in your answers, type your answers in the description box. No, not description box, but in the comment section or here in our chat box. All right. But while waiting for your replies here, I'm going to have to start rationalizing. Letter A, the pain is usually bilateral and affects both sides of the face. The clue here is usually. Remember about the Most of the trigeminal neuralgia doesn't involve bilateral effect. This one right here, the bilateral, is mostly seen in a patient with multiple sclerosis. So it's not usually, okay? This makes the statement false. Take note, guys, that the trigeminal neuralgia typically affects one side of the face, meaning it affects only one side, unilateral, right? Even though there are cases that can involve the both sides, especially with MS. But take note that in the classical presentation, it is going to be unilateral, not bilateral. Unilateral. Most cases. There's only a few cases that can involve the bilateral pain. So this is going to be wrong. Letter B. Trigeminal neuralgia is more common in women over 50 years old. Yes, that is true. The incidence will increase with age and making this demographic more likely to be affected. This is a true statement. Affecting more women over the age of 50, that is correct. What about letter C? The pain typically involves the ophthalmic, ophthalmic of the branch of the nerve. That is correct. Yes, that's part of the branches here. So aside from that one, it can affect the maxillary, also affect the mandibular branch. So this is just one part of it. This is correct. Actually, guys, the pain typically involves the ophthalmic. Yeah, that is correct. And we also have other sites, the mandibular and the also the, what do you call this? Mandibular and the maxillary. What else? Anticonvulsant medications are the first line of treatment for the trigeminal neuralgia. Is that correct? Yes. Anticonvulsant medications such as the carbamazepine or the oxcarbazepine. Those are the first line drugs in the treatment. What else? Letter E. An MRI can help identify if vascular compression is causing the trigeminal neuralgia. That is also correct. Letter F. The patient's condition is likely secondary to multiple sclerosis given her age and symptoms. The age of our patient is already 58 years old. So she's past that 40-year cutoff. So this is not caused by the multiple sclerosis. This is wrong. All right, remember about the year, 40 years old in women. This is associated to the MS, but not greater than 58 years old. All right, so the implication here, okay, marking that one as wrong. So our correct answers are the following. We have letter B, we have C, D, E. We don't have A and F this time. Okay, guys, that's it. Let's move on to the next question. Number 2, which nursing intervention is essential in managing the care plan for a patient suffering from trigeminal neuralgia? Is it A, monitor closely to prevent dehydration and malnutrition? B, encourage exercises involving the jaw and facial muscles? C, use cold compresses on the painful area? D, stress the importance of regular teeth brushing. It said here, which nursing intervention is essential in managing the care plan for a patient suffering from trigeminal neuralgia? Will you do A, B, C, or D? Suffering from trigeminal neuralgia. We are not talking about post-op, okay? So pre-op, not post-op, guys. Take note. This is for the patient that has the trigeminal neuralgia not involving surgical procedure. All right, I'll let you be. Okay. Let's have letter A. Monitor closely to prevent dehydration and malnutrition. Remember, guys, that the patient with a TN, this is a condition that can cause severe, debilitating pain in the face. And not just the face, it can affect their chewing, their drinking, their eating, their talking, to prevent dehydration and malnutrition. Take note that they're gonna have the severe, debilitating facial pain. It's not like just a regular toothache. No, it's worse than that. It is like a shock-like intense pain. This can be debilitating. Their nutrition is affected. Eating, drinking, like I have said earlier, they will refrain from eating, drinking, even talking. Okay? So they will be avoiding these activities in order to prevent the attacks. So they are prone to developing the dehydration and malnutrition. So that is our part of the care of our patient. If you're going to include letter B, which is encouraging exercise involving the jaw, the chewing, that is, if you're going to let them do that, this will exacerbate the trigeminal nerve. All right? It can cause more of the neuralgia. It will lead to more intense pain. Exercise exacerbates pain. So, this should be avoided. Even the facial manipulation, even just simple touch to the jaw area, can also aggravate the trigeminal neuralgia. No, none of those should be applied to the patient's face. All right? No exercises this time. If you're going to apply cold compress on the painful area, this is something that is applicable in other conditions, but not in a patient with TN. The simple application of the cold compress, even hot compress, warm compresses, these are the following triggers. Warm, either warm or cold compress. Also touching the face. So these are supposed to be avoided by this patient. No cold compress. What about this one? Stress the importance of regular teeth brushing. We know that this is hygienic, right? But for a patient with a trigeminal neuralgia, this is actually going to be discouraged. So how are we going to implement the oral care for this patient? Instead of regular teeth brushing, we're not going to promote that. They should be using gentle mouth rinses, not tooth brushing. Gentle mouth rinses, no cold drink, no warm drinks, and soft toothbrush. And should not be vigorous when they are applying the toothbrush, because this can aggravate the trigeminal neuralgia pain. Soft toothbrush, not vigorous brushing. Okay, so our correct answer here is letter A. Monitor closely to prevent dehydration and malnutrition. So I hope that you're understanding now the precaution, the teaching that you should impart to your patient. All right, let's move on to question number 3. What symptoms should the nurse expect when assessing a patient with tic douloureux? Select all that apply. Is it A, numerous small red spots on the skin? Is it B, intense sharp facial pain? C, involuntary mouth movements? D, weakness on one side of the face? E, fine tremors of the eyelid? What symptoms should the nurse expect when assessing a patient with tic douloureux? Select all that apply. Is it A, numerous small red spots on the skin? B, intense sharp facial pain? B, involuntary mouth movements? D, weakness of one side of the face? And E, fine tremors of the eyelid? What is your answer this time? Okay, while waiting for your responses, I'm going to start rationalizing. Let me have letter A. Numerous small red spots on the skin. This is basically petechiae, right? Is petechiae expected in a patient with TN? No, this is not a manifestation of TN. The petechiae are actually, they are a sign of minor bleeding under the skin. And again, this is not a typical manifestation of the TN. All right. So go back into the concept that the TN is going to affect the trigeminal nerve, the fifth cranial nerve. So remind yourself about the fifth cranial nerve. This is the facial pain. We are not going to expect petechiae. Now, what about letter B? Intense sharp facial pain. Yes, of course, that is the correct answer. That is the hallmark in the patient with the TN. They will have that characteristic intense stabbing, electric shock-like facial pain. And this is something that can occur when there is stimulation to the nerve. All right, so that's one. What about letter C? Involuntary mouth movements. Involuntary mouth movements. Remember that the tic douloureux can affect the three branches: the ophthalmic, the maxillary, and the mandibular. So the twitching, this is basically the twitching of the face. Twitches of the muscles, the spasms of the facial muscles. And this will include the muscles surrounding the mouth, and this is caused by the irritation or hyperactivity of the trigeminal nerves. All right, so that is one of the answers. What about D, weakness on one side of the face? Did we say anything about weakness on one side of the face? No, we don't anticipate this one. The weakness on one side of the face can be seen in a patient with Bell's palsy, but not in trigeminal neuralgia. What about here? Fine tremors of the eyelid. Remember about the ophthalmic branch of the trigeminal nerve? Yeah. Are you sure this is part of it? Fine tremors. Fine tremors. Quite close, but this is basically not part of the tic douloureux. The twitching is manifested mostly on the lower part of the face, the mandibular involvement. But on the eyelid, fine tremors, this is what we call as a blepharospasm. Okay? Blepharospasm, and this is involvement of cranial nerve number 3. Cranial nerve 3. The oculomotor nerve. So blepharospasm is not part of our tic douloureux. Okay? This is something that is not expected in this patient. They will feel the pain, but take note, the ophthalmic is more on the ophthalmic branch of the trigeminal nerve will only cause increased transmission of the painful sensation. It's mostly sensory, okay? So please take note. The ophthalmic branch will not involve the motor function, but only sensory. So you will not see the fine tremors in a patient with a TN. Okay? No tremors in the eyelid, only pain sensation. The tremors that you will see, or the mouth movements, this is caused by the involvement of the mandibular nerve. Okay? So our correct answers are only letters B and letter C. All right, guys, let's move on to number 4. What should a nurse do to avoid triggering a patient, or a pain attack rather, in a patient with a tic douloureux? Let me reread. What should a nurse do to avoid triggering a pain attack in a patient with tic douloureux? Is it A, avoid creating drafts by moving swiftly near the patient? Or is it B, keep the patient lying face down? C, stop oral hygiene completely? D, frequently massage both sides of the face? What should a nurse do to avoid triggering a pain attack on a patient with tic douloureux? Would you do letter A or B, or is it letter C, or is it D? All right, let me start eliminating some options here. If you answered letter D, frequently massaging both sides of the face, remember guys, the application of touch into the patient's face is enough to cause the pain. Massaging can even stimulate more into the trigeminal nerve. It can trigger the attacks. Triggers the attack. There should not be massaging of the face. What about letter C? Stop oral hygiene completely? Are you serious? No, that is not supposed to happen in this patient. They can still do oral care, and they can use the gentle application of the brush, or they can use the mouthwash as well in order to prevent overstimulation of the trigeminal nerve. They're going to use the soft toothbrush, use mouthwash. Yeah, those are the alternative. The word completely makes this statement wrong. Letter B, keep the patient lying face down. Yeah, if you were going to put them on a prone position with their face touching into the pillow or maybe the bed surface or the mattress, this can actually cause the patient to stimulate the trigeminal nerve as well. It can exacerbate the pain. So they should adopt those other positions of comfort that do not irritate the trigeminal nerve. Okay? Exacerbates TN. So we don't have any other answer other than letter A, avoiding creating drafts by moving swiftly near the patient. Okay, so that is the correct answer. This is going to prevent even the slight air movements or drafts can trigger the episodes of the attack. So we should avoid this one. Avoid creating drafts by moving swiftly near the patient. You should avoid this as an RN. Answer is letter A. All right, guys. So make sure that you recall all those actions, strategies, precautions in a patient that has the TN. Again, remember about those triggering factors. Take note about those triggering factors. Cold temperature, warm temperature, application of touch. What else? Drafts. Okay, so take note about those triggering or contributory factors. Now this time let's talk about number 5. Which medication is commonly prescribed for managing trigeminal neuralgia? Is it A, vitamin C, B, morphine, C, allopurinol, D, carbamazepine? This is a given. It's quite easy. Which medication is commonly prescribed for managing trigeminal neuralgia? Vitamin C is a supplement. It can support general health, but it's not going to treat trigeminal neuralgia, so we are eliminating that. Morphine is going to be a strong opioid, right? It is a management for a severe pain, but it will not address the underlying cause of the trigeminal neuralgia. So we are eliminating that one as well. Allopurinol, this is intended to those patients who have dysfunction in their purine metabolism. This is intended to those patients that have high uric acid levels in their blood, gout arthritis. We are eliminating that as well. We are left with the anticonvulsant drug. Okay, that is our carbamazepine. Okay, here is a supplement, but doesn't treat the underlying issue. Morphine, intended for severe pain. It is a narcotic, analgesic, but it will not address the underlying issue. Allopurinol is for patients that have increased uric acid levels. So we don't have any other answer other than the carbamazepine. Let's head out into the next item, number 6. When assessing a patient with a trigeminal neuralgia or tic douloureux, which symptoms should the nurse expect to find? Select all that apply. Is it A, long periods of sleep due to anxiety, or is it B, increased activity levels because of medications, or is it C, fatigue and exhaustion resulting from severe pain, or is it D, excessive talking due to anxiety and worry, and letter E, poor nutritional intake due to fear of triggering an attack? So the question here is, when assessing a patient with trigeminal neuralgia, which symptoms should the nurse expect to find? Will they have long periods of sleep, or are they going to have increased activity, or are they going to be fatigued, or are they going to be excessively talk because of the anxiety, or are they going to have poor nutritional intake? Or your answer? Mary answered letter C and E. Yes, those are the correct items. We have letter C and letter E. Exhaustion resulting from the severe pain, poor nutritional intake due to fear of triggering an attack. Long periods of sleep due to anxiety, is that really the main reason why they are going to be exhausted? No. The sleep pattern of your patient is actually disturbed. There's not such a thing as long periods of sleep. There is sleep disruption. It is impossible for them to even maintain sleep because of the intermittent pain. Okay? What about letter B? Increased activity levels because of the medications. Recall about the side effects of the drugs, right? Side effects of anticonvulsants. Do you remember those side effects or the adverse effects? The dizziness, the drowsiness. They're not going to be having increased activity when they're taking those medications, especially anticonvulsants. They will not have hyperactivity. All right. So this is also wrong. Letter D, excessive talking due to anxiety and worry. Remember about the talking. When they're going to talk, this is going to stimulate the mandibular nerve. This can also trigger the attack. talking overstimulates the mandibular nerve, thus triggering attack. Okay, so we have letters B and letter E. So poor nutritional intake. It's not excessive talking. They are going to avoid talking. They're not going to engage so much with conversation because they don't want any triggers. Let's move on to number 7. What should the nurse advise the patient to do to reduce the chances of triggering neuralgia pain? Is it A, consume cold beverages, B, skip oral hygiene practices, C, use heated compresses, or D, chew food on the side of the mouth that is not affected? What is the answer? This is quite interesting. You got to find that instruction or that advice that will reduce the chances of triggering the TN. Guys, eliminate those triggering factors. If you are not quite sure, try to do the elimination process. Remember about the cold beverages, right? That will send the cold sensation to the mandibular nerve, causing that attack. Cold drinks can exacerbate the pain in trigeminal neuralgia. Extreme temperature should be avoided. So this is wrong. It can trigger the episode. What about B? Skip oral hygiene practices. As I've said earlier, they should not skip that. They will need to have oral hygiene. It's not completely avoided. They can minimize that by using the soft toothbrush or using that oral rinse or mouthwash. This is wrong. Heated compress, another extreme temperature. Yeah, this is to be avoided. We can promote the reduction of the pain sensation by allowing them to chew the food on the side of the mouth that is not affected, especially that we know that it is unilateral, right? It's not going to affect both sides in most cases, all right? So this is the most realistic advice that we can give to our patient. Letter D, chew food on the side of the mouth that is not affected. This is going to prevent the stimulation of the trigeminal nerve. It will reduce the triggering pain. All righty, let's move forward with number 8. When evaluating a patient newly diagnosed with trigeminal neuralgia, what should the nurse inquire about? Is it A, vision issues related to drooping eyelids, B, specific triggers that cause facial pain, C, decreased appetite due to loss of taste, D, weakness on one side of the face? The question states, when evaluating a patient newly diagnosed with TN, what should the nurse inquire about? Is it vision issues related to drooping eyelids, or is it B, specific triggers that cause facial pain, or is that decreased appetite because of the loss of taste, or is it D, weakness on the side of the face? Princess answered letter D. Let's take a look about letter D. Will that be the answer? Weakness on one side of the face. This is related to Bell's palsy. This is not something that you can see in a patient with trigeminal neuralgia. So we are going to eliminate this option. Not observed in TN. What about letter C? Decreased appetite due to loss of taste. Is there loss of taste in trigeminal neuralgia? No, there is not that effect. Remember about the table that I showed you earlier? It's not affecting the taste. The patient, though, will have some problems in eating, drinking, because of the pain that they will have when they're going to be chewing on some food. All right? Not about the taste. Okay? This is false. Taste is not affected in TN. Let's talk about letter B. Specific triggers that cause facial pain. Will that be the answer? Specific triggers. Yes, that is the correct answer. We know that the primary feature of the trigeminal neuralgia is basically facial pain, right? This is triggered by that specific stimulus. Touching, eating, wind. So this is our correct answer. Triggers. Again, touch, eating, that's another one, and wind or the draft. Cold temperature or heat. Yeah. Take note of those. If you answered letter A, vision issues related to drooping eyelids, remember I said about the sensation effect on the ophthalmic nerve. Remember about that? It's not going to cause drooping. This is what we refer to as ptosis. This is not seen in a patient with TN. Okay, this is a condition that you will often see in other neurological conditions like the myasthenia gravis, right? Yeah. It doesn't involve the motor function of the eye in a trigeminal neuralgia. It will only affect the sensation of the eye, ophthalmic nerve. So let me just go back into that table. Answer is letter B. We are on page 1317. So let's just go back to that table real quick. Remember this table? Okay. So I'm not seeing the transition of the screen yet. So I'm going to wait. Take a look into the effect of those branches of the trigeminal nerve. Remember about the ophthalmic nerve? This is mostly going to influence the sensation, the upper part of the face. The same thing with the maxillary nerve. This will only influence the sensation. Okay? So you're not going to see ptosis in the trigeminal neuralgia because it's not going to influence the motor function. However, when you're going to look into the mandibular nerve, this is going to affect both sensory and motor function. So the patient will feel both the pain and their motor function. You will see that twitches. Okay? All right. So take note of those manifestations. Now let's go back into that question. Where are we? 1317? I believe that was it. So the answer here is letter B. Specific triggers that cause facial pain. Let's have number 9. What should the nurse include in the care plan for a patient suffering from the trigeminal neuralgia pain? Is it A, evaluate the patient's fluid and food intake? Or B, use cold packs on the affected area for 20 minutes. C, teach methods to relax facial muscles. Or is it D, spend time conversing with the patient? The question here is, what should the nurse include in the care plan for a patient suffering from trigeminal neuralgia pain? Is it A, is it B, is it C, or D? If you answered letter D, spend time conversing with a patient, will this help? When you're talking or interacting with a patient, this might stimulate the affected area of their face. When they're going to start talking, it can trigger the attack. So again, the patient here is going to minimize those triggering activities. So can actually trigger the attack. What about letter C? Teach methods to relax the facial muscles. Teach methods. What are those methods that this question is talking about? We know that relaxing the facial muscles are actually it is a beneficial overall stress management. But again, this is not going to address the direct pain caused by the trigeminal neuralgia. This is caused by the nerve sensitivity. It's not about the muscle tension. This is about nerve sensitivity, not about facial muscles, not that. Though it can trigger the twitches, but not necessarily going to address the direct or the underlying issue in this patient. Nope, not going to relieve that. What about letter B? Use cold packs on the affected area for 20 minutes. This is a trigger. We are supposed to eliminate that. It's not going to treat the patient. Remember, guys, this is a question that is quite similar to the previous question that I've asked you. Evaluate the patient's fluid and food intake. Remember that they're going to have issues with their nutrition. They are afraid to have the attack. So eventually they will just not eat. They're not going to drink. So this is what we should look for. Okay? You are going to teach them instead in doing that technique. They will eat. They will put the food into the other side of the face that is unaffected. 2, avoid dehydration and avoid malnutrition. All right. Congratulations, Melrose. Okay. So the correct answer here is letter A. Let's have some more question here. We're still halfway. Number 10. Which assessment should the nurse perform to identify potential complications of trigeminal neuralgia? Is it A, have the patient clench their jaws, B, examine the oral mucosa and teeth, C, check the face, skin temperature on both sides, or D, lightly touch the affected side to find trigger points? Which assessment should the nurse perform to identify potential complications? So are you going to have the patient clench their jaws? What do you think about that? All right, let's eliminate the options here. What about letter A? Have the patient clench their jaws. This is incorrect because when they're going to do this step, this will actually affect the hang on a sec. Potential complications of trigeminal neuralgia. Identifying complications. So if you're going to have them do letter A, it is not going to reveal the complications because the condition basically can affect the sensory branches of the trigeminal nerve, not the motor branches involved in the jaw movement. So we will eliminate letter A. What about letter B? Examine the oral mucosa and teeth. Will this be it? Examine the mucosa and teeth. Remember, guys, that our patient will be prone to neglecting the oral care because of the pain. So they're going to be prone to developing those dental problems, gum disease, oral infections. That is the correct answers. Possible neglect in oral care. So this is what you should look for, guys. Gum disease, oral infections, because they will be prone to, hey, I'm just not going to brush my teeth. I'm just afraid that I'll have that painful episode again. What about letter C? Check the patient's skin temperature on both sides. It's not really going to check for that complication. The temperature check bilaterally is only assessing, the temperature, the superficial temperature. It's not going to really have an in-depth assessment about the complication, especially the oral cavity. So we are eliminating that as well. Lightly touch the affected site to find trigger points. Light touching, yes, you're really going to cause that attack. So never do that light touch. This will not evaluate the complication, which is basically the oral complications. It will only trigger the pain, but will not check for the complications, which is the gum disease, infection in the mouth. Yeah. Let's have number 11. If a physician prescribes carbamazepine, Tegretol, 1,200 milligrams twice daily for trigeminal neuralgia, what should the nurse do first? Is it A, give the medication with food? B, advise the patient to report unusual bleeding, bruising, or fever? C, question the dosage as it exceeds the recommended limit? Or is it D, store the medication in a cool, dry place? Tegretol, 1,200 milligrams twice a day. So what you should do here in this scenario, twice a day. If you answered letter A, give the medication with food. We know that the medication can cause some GI upset. Yes, it can be diminished by taking with some food. Yes, this can help. But the dose here, which is basically 1,200 milligrams, is already huge. This is over the recommended dosing schedule. So we are going to eliminate letter A. The answer here is to question the dosage as it exceeds the recommended limit. That is the correct answer. We should be questioning that order this time. Okay? If you're going to store the medication in a cool, dry place, this is also a good intervention. You can advise the patient to do proper handling, proper storage of the medication container. But then again, our issue here is the dose of our Tegretol. And if you advise the patient to report unusual bleeding, bruising, and fever, take note, guys, Tegretol. Do you remember about the adverse effect of the Tegretol? This can lead to the cell counts that are low. Yeah, we can actually teach them that, but there is a much more of a higher priority here, which is the dose exactly that is way too high for the recommendation. So we have to eliminate that as well. We are going to deal with that things first. Okay? So our correct answer is letter C. Guys, let's move on to the next item, number 12. A 65-year-old male patient with trigeminal neuralgia presents with the persistent facial pain despite being on carbamazepine. The healthcare provider plans to switch him to oxcarbazepine. What should the nurse be aware of regarding oxcarbazepine therapy in trigeminal neuralgia? Select all that apply. Is it A, oxcarbazepine is an anticonvulsant that may have fewer side effects than carbamazepine? Or is it B, the patient should be monitored for signs of hyponatremia while on oxcarbazepine? Or C, oxcarbazepine is contraindicated in patients with a history of liver disease? D, it is important to assess for any changes in renal function during the oxcarbazepine therapy. Letter E, the effectiveness of oxcarbazepine is not effective by the patient's age, affected rather. And letter D or letter F, oxcarbazepine therapy may cause dizziness and double vision as side effects. So this is a question that is all SATA. So while waiting for your replies, okay. So you're answering A, E, F. A, E, F. What else? Any more? All right, let's have the rationales this time. If you had answered letter A, oxcarbazepine is an anticonvulsant that may have fewer side effects rather than carbamazepine, this is a true answer. This is a correct answer. As I have said earlier, that the medication is a newer anticonvulsant that is structurally related to the carbamazepine, but it has fewer side effects. So again, this is going to be a much preferred medication compared to the carbamazepine. That is true. All right, so that's letter A. What about letter B? The patient should be monitored for any signs of hyponatremia while on oxcarbazepine. That's also part of that. The patient's sodium level will also be decreased. And this is something that should be monitored as well, especially if they are going to have the confusion, nausea, and fatigue. That's another correct answer. What about letter C? Oxcarbazepine is contraindicated in patients with a history of liver disease. Is that correct? Oxcarbazepine is contraindicated in patients with a history of liver disease. Not specifically contraindicated in liver disease, but the caution is advised as with similar to other medication. So we are eliminating that one. It's not going to cause that problem like the carbamazepine. Remember about the carbamazepine? Letter D, it is important to assess for any changes in renal function during oxcarbazepine therapy. Will that be it? It is important to assess for any changes in renal function. Yes, that's one of those. Remember that the drug can be metabolized and it is excreted primarily via the kidney. So it will require adjustment to the drug. So that's another correct answer. Let's have letter E. The effectiveness of oxcarbazepine is not affected by the patient's age. That is incorrect. As we know that age can affect the metabolism, especially the effectiveness of the drug. So older patients are known to have altered tolerance to the medication. They probably would require some dose adjustments, especially that their function in their kidneys is also going to be affected as well. So this is letter E, effective score is not affected. No, that is false. Not is a word that is making the statement false. So we are eliminating that one. Letter F, oxcarbazepine therapy may cause dizziness and double vision as side effects. Yes, this is one, or these are the other manifestations, side effects of the drugs, of the drug rather. So we are selecting our answers this time. We have letter A, letter B, and letter D, and also A, B, D, and letter F. Take note, our correct answers here are A, B, D, F. Moving forward to our next question, we have number 13. A patient with a history of trigeminal neuralgia comes to the clinic for a follow-up. She reports that her medication has become less effective and her pain episodes are increasing in frequency. The healthcare provider is considering surgical options. Which of the following are potential surgical treatments for trigeminal neuralgia? Select all that apply. Is it A, microvascular decompression, or B, deep brain stimulation rather, C, lumbar puncture, D, stereotactic radiosurgery, E, percutaneous balloon compression, or letter F, temporal lobectomy? So which of the following are potential surgical treatments for trigeminal neuralgia? Al-J Jose answered A, B, D, F. Okay, A, D, E for Mary. Let's have those options. Letter A, microvascular decompression. This is that procedure, right? That is going to involve repositioning or removing the blood vessels that will cause compression to the trigeminal nerve. So that is actually one of those procedures that can treat the TN. What about deep vein or the deep brain stimulation? What is this? Deep brain stimulation? Probably I don't think I've mentioned this one. Deep brain stimulation. This is also a treatment that is not popularly used, but it can also be used for those patients with a TN. Okay. This is going to be applicable for a patient that may have the classic trigeminal neuralgia. So this is actually one of those. Less popular, but also used. What about letter C, lumbar puncture? No, we are eliminating that one. We don't need to get that CSF sample. It's not involved. So that collection of fluid is not needed this time. We don't have to look for glucose. We don't have to look for infections in a case of TN. This is not part of the diagnostic testing or a procedure to relieve pressure. There's no such thing. D, stereotactic radiosurgery. What is this? This is the gamma knife surgery, right? It will deliver the radiation to the trigeminal nerve root, creating that lesion, and it will also reduce the pain signals. Remember about this procedure, stereotactic radiosurgery. What about this one? The percutaneous balloon compression. Remember about that insertion of a small balloon. This is going to be inflated. It can compress the trigeminal nerve, and this will alleviate the pain as well. So we are going to include that. Balloon compression. And letter F, temporal lobectomy. What is this procedure? This is a treatment for epilepsy. Not trigeminal neuralgia. So this is also incorrect. So we have our correct answers. Letter A, letter B, letter D, and letter E. So those are the correct answers. All right, guys, let's have number 14. A patient with TN is scheduled for stereotactic radiosurgery. The patient expresses concern about the procedure. Which statements about stereotactic radiosurgery should the nurse include in the patient teaching? Select all that apply. Is it A, the procedure is non-invasive and typically performed on an outpatient basis? Is it B, stereotactic radiosurgery requires a lengthy recovery period? C, the procedure uses focused radiation to create a lesion on the trigeminal nerve. Or D, immediate pain relief is expected following the procedure. Or letter E, side effects may include numbness or tingling in the treated area. And lastly, letter F, stereotactic radiosurgery is only effective if there is visible vascular compression. We're talking about to select all that apply regarding stereotactic radiosurgery. All right, let me start rationalizing. Let me have letter F first. What is in letter F? Stereotactic radiosurgery is only effective if there is visible vascular compression. This is false. The option is incorrect. It said only effective if there is visible vascular compression. This is what's gonna cause this answer or option to be incorrect. Only effective if there is visible vascular compression. No. The radiosurgery can be effective even when there is no visible vascular compression present. Yes. It targets the nerve itself. So it has a direct effect into the trigeminal nerve. This is a non-invasive procedure, stereotactic surgery, radiosurgery. It involves with that use of the gamma. Letter E, side effects may include numbness or tingling in the treated area. Side effects can include numbness or tingling. Yeah. Remember about the intentional damage to the nerve fibers? These are expected. Numbness, tingling in the treated area. As we are going to intentionally damage the trigeminal nerve. What about letter D? Immediate pain relief is expected following the procedure. Is that correct? Letter D. Immediate pain relief. Like I've said earlier, it will take for several days, even weeks, even for months to to allow the patient to feel a change in their pain sensation. Not immediate. This is making the statement false. It can take several days or weeks. Alrighty, so this is also wrong. What about letter C? The procedure used focused radiation to create a lesion on the trigeminal nerve. Remember about that? Radiation? Yes. They are going to use that radiation treatment directly exposing or directly pointed into that particular part of the head to target the trigeminal nerve. And again, this is to interrupt the pain signals. So that is the correct answer. All right. So that is the correct answer. What about letter B? Stereotactic radiosurgery requires a lengthy recovery period. Does it require a lengthy recovery period? No. There is no incision involved. The patient can usually resume their normal daily activities after the procedure. No lengthy recovery period. This is false. Patient can resume usual daily activities immediately after the radio surgery. What about letter A? The procedure is non-invasive and typically performed on an outpatient basis. Yes, this is also one of the correct answers. This is non-invasive and the patient can show up into that surgical center, radio surgical center, and they can go home to their respective homes after the procedure, same day. It is an outpatient, same day procedure. So this is part of the answers. We have answers, letter A, letter C, and letter E. Okay. Very good, Mary. Very good. And for those who got some correct answers, good job, guys. Number 15. A 70-year-old female patient with type 2 trigeminal neuralgia experiences constant burning facial pain. Remember about the type 2? It is constant, right? It's not one of those intermittent, sharp, intense pain. She is unable to tolerate high doses of anticonvulsants due to the side effects. The healthcare provider is considering neuromodulation therapy, which I did not mention earlier. Okay. What considerations about neuromodulation should be discussed with the patient? Select all that apply. Is it A, neuromodulation involves implanting electrodes to stimulate the trigeminal nerve? B, this therapy is reversible and can be adjusted if needed? Or C, neuromodulation is only effective for acute episodes of pain? D, the patient will experience immediate pain relief once the device is implanted? E, this treatment can be considered when medication management fails. Is that correct? Or is it F, neuromodulation is a permanent solution and cannot be removed once implanted? So this is one of the modalities that I did not include in the lecture earlier because it was going to be asked, all right? So try your best to eliminate those other options. She's not able to tolerate the side effects or the adverse effects of the anticonvulsant drugs. And so this is a recommendation that is going to be presented to the patient. But what are those considerations that the patient should know before this procedure is to be carried out? While waiting for your responses, let me have the rationales. This time, letter A. Neuromodulation involves implanting electrodes to stimulate the trigeminal nerve. Yes, that is one of the correct answers. Letter A. The neuromodulation is going to have that implantation of electrodes. This is going to stimulate the trigeminal nerve, deliver electrical stimulation to the trigeminal nerve in order to modulate the pain signals. That is the desired effect, to modulate the trigeminal nerve in order to lessen its hyperactivity in transmitting those pain signals to the brain. This is how the procedure is going to work. What about letter B? This therapy is reversible and can be adjusted as needed. Yes, that is also true. The settings can be adjusted according to the patient's needs, so it will be much more flexible option for the pain management. This is also true. What about letter C? Neuromodulation is only effective for acute episodes of pain. That is false. Only for acute episodes of pain, this makes the statement incorrect. The neuromodulation is not limited to the acute phase or, the acute pain episodes. It is going to manage chronic neuropathic pain conditions. Not acute, but chronic neuropathic conditions. So this is an effective measure. So this is a wrong option because of that acute episode statement. What about letter D? The patient will experience immediate pain relief once the device is implanted. What do you think about letter D? Experience immediate relief is false. The patient will require some periods of adjustments before they're going to be able to achieve that maximum implant pain control. Okay, so it's not going to be an instantaneous pain control. We are going to mark that as a wrong option. What about letter E? The treatment can be considered when the medication management fails, or this can be indicated when the patient is unable to tolerate those adverse effects. Yes, that is true. What about letter F? Neuromodulation is a permanent solution and cannot be removed once implanted. That is false. It is not permanent. Okay. It can be adjusted if necessary. So again, it is an adaptable type of treatment option. It is reversible. Okay. Reversible. We are tagging that as a false answer. So we have letters, letter A, B, and letter A. Okay. Good job, guys. Let's have number 16. When preparing discharge instructions for a patient with trigeminal neuralgia, which activity should the nurse advise the patient to avoid to prevent triggering an attack? Is it A, washing the face, B, getting sun exposure, C, using artificial tears, D, consuming large amounts of fluids? The statement is, when preparing discharge instructions for a patient with trigeminal neuralgia, which activity should the nurse advise the patient to avoid to prevent triggering an attack? Is it A, B, C, or D? Remember, guys, about the stimulation of the face merely by light touch? That is enough to trigger the attack. Avoid. That is the main question right there. Very good, Uba. That's the correct answer. Washing the face. That is the correct answer. Washing the face. Remember that when they have the TN, it can trigger the pain because it involves touching or stimulating the facial nerve. So any activities that will include contact or involve contact with the face, it should be minimized to avoid provoking an attack. If you answered letter B, getting sun exposure, this is incorrect. It doesn't trigger. Does not trigger. All right. Artificial tears, will that be a trigger to the patient? Application of the artificial tears? No. They are going to be used to relieve the dryness. Not a trigger. Eye drops can prevent dryness of the eyes. Prevents dry eye syndrome. All righty. What about letter D? Consuming large amounts of fluids. Will this be avoided or contraindicated? No, it is not directly associated with the trigeminal neuralgia attacks. What you should watch for instead is the extreme temperature. Okay? It is incorrect. Watch for temperature extremes, not about the volume. There is no contraindication as to the volume, but the extreme temperature instead. So we have to pick letter A. Very good, guys. Almost through here. Let's have number 17. When administering carbamazepine to a patient with trigeminal neuralgia, which precaution is important? Is it A, Tegretol is free from serious side effects, B, monitor the patient for bone marrow suppression, or C, the medication may cause kidney issues, or D, start the medication at the highest dose for effectiveness? Your answer, please. When administering carbamazepine to a patient with trigeminal neuralgia, which precaution is important? Is it A, B, C, or D? Yeah, I actually wrote down all of those. Long list of adverse reactions in carbamazepine. So I hope that you can recall those. Which precaution is important? We are talking about the carbamazepine, Tegretol, but among the options here, what would be that precaution that you should observe? Letter A. Let's have letter A. Tegretol is free from serious side effects. That is false. Free? Nope. It has significant adverse effects, even side effects. One of those would be the bone marrow suppression, which is letter B. Okay. Correct answer is letter B. Monitor the patient for bone marrow suppression. It can cause the aplastic anemia. What else? They will be prone to developing infections. There's many. Drowsiness, dizziness. What else? They will also have the nausea. Monitor the patient for bone marrow suppression. This is a huge thing, guys, for the patient taking the carbamazepine. All right. If you answered the medication may cause kidney issues, would that be that high priority? Is that really associated closely to kidney issues? We know that our patient will be screened properly, right, as far as the liver and kidney function. But the patient taking the carbamazepine is at a higher risk to developing the bone marrow suppression compared to the kidney issues. It doesn't mean that we're not going to screen their renal function or hepatic function. It doesn't mean like that. But as far as adverse effect or the side effect of the drug, we are going to be much more concerned regarding the bone marrow suppression this time. It is known more to affect the blood counts of our patient compared to the kidney issue. So we are eliminating that. Letter C. And then letter D, start the medication at the highest dose for effectiveness. Really? If you're going to allow this to occur in your patient, starting with the highest dose, it should instead be started in lower dose up until the patient will have some adjustments if they're not really getting the the desired effect, then the medical provider will have to gradually increase the dose up until it is appropriate for the patient. They will be getting the adequate pain control. So this is a false statement. Highest dose. No, there should be a gradual dose change, starting with low up until the patient will achieve that pain control. So the correct answer here is letter B. Number 18, before beginning treatment with Tegretol for trigeminal neuralgia, what important information should the nurse provide to the patient? Is it A, calcium supplements should not be taken together with this drug? B, regular monitoring drug levels is necessary. C, this medication may cause increased activity and restlessness. D, tinnitus might occur during the initial treatment phase. The question is, before beginning treatment with Tegretol for trigeminal neuralgia, what important information should the nurse provide to the patient? Is it calcium supplements should not be taken together with this drug? Or is it B, regular monitoring of drug levels is necessary? C, the med may cause increased activity and restlessness. D, tinnitus might occur during the initial treatment phase. Take your best guess. If you had answered letter A, calcium supplements should not be taken together, is there such drug interaction? Is there such drug interaction between the two? There is no known drug interaction between calcium and the carbamazepine. None. So it is not contraindicated. All right. So we are going to eliminate that one. Letter B, regular monitoring of drug levels is necessary. Remember, guys, this is an anticonvulsant drug. Yeah, anticonvulsant medication. There should be regular monitoring of the drug levels to avoid toxicity. This is the correct answer. Letter B, to avoid toxicity. Yeah, we really need to have that in order for us to keep going treating this patient, but you got to be careful, make sure that we have that information in order to at least allow some dosage changes for this patient. And yeah, our goal here is to safeguard our patient from developing any toxic levels of the medication. It has a narrow therapeutic window. Okay. If you had answered letter C, medication may cause increased activity and restlessness, remember that this is an anticonvulsant. It is going to cause drowsiness. It can also cause dizziness. So increasing activity is somewhat paradoxical, not expected. Okay. Due to drowsiness and dizziness. Sedation. Yeah, that's actually part of the drug effect, sedation. So I doubt that they would be using their motorbike, doing some wall climbing. If you're dizzy, you will be avoiding these activities that would require mental alertness. So those are stuff or activities that should be avoided in this patient taking the anticonvulsant medication. So this is also wrong. Letter D, tinnitus might occur during the initial treatment phase. Is it correct? Well, it is incorrect, guys. It is not a common side effect of the carbamazepine. We know that its primary adverse effects are the following: the dizziness, the nausea, the drowsiness, bone marrow suppression, but not tinnitus. Okay, we are removing that as well. Now let's move on to the next question, number 19. For a 48-year-old patient recently diagnosed with trigeminal neuralgia and experiencing one-sided facial pain, what should the nurse consider? Is it A, the patient will need lifelong anticholinergic meds, or B, there is a high likelihood of developing myasthenia gravis in the patient or in the future? Or is it C, the patient should be assessed for multiple sclerosis? Or is it D, the condition is self-limiting and will eventually resolve without treatment? Remember about the clue that I gave you earlier regarding the age? Mostly if they will have the incidence starting at the age of 40 or less than 50, yeah, they should be evaluated, making sure that they have diagnostic tests to determine if they have multiple sclerosis. Remember about multiple sclerosis? This involves demyelination of the nerve fibers as well, right? Yeah. So the correct answer here is letter C. Regarding the patient's age, they should be assessed for multiple sclerosis. Anybody, any female less than 50 years old, or if they are in their 40s, they should be assessed, because as we know that multiple sclerosis is a secondary contributing factor to the trigeminal neuralgia. Remember about that table that I showed you earlier? Yep, that is the correct answer. Contributing factor. There is demyelination of the nerve fibers. Good work, guys. You're answering these questions more correctly today. What about letter A? The patient will need lifelong anticholinergic medications. Did we talk about anticholinergic drugs? Nope, we did not. The trigeminal neuralgia is not treated by anticholinergic medication. We don't use anticholinergic drugs to a patient with TN. We are going to treat them with what? Anticonvulsants. Anticonvulsants. Muscle relaxants, right? But most often we are going to anticipate the use of the carbamazepine, oxcarbazepine. Yeah. Letter B, there is a likelihood of developing myasthenia gravis in the future. Was there a relationship between the two? No, we didn't talk about that. No relationship at all between TN and the development of myasthenia gravis. Those are two distinct, different conditions, different pathophysiologies, not even related. The condition is self-limiting and will eventually resolve without treatment. Nope, it is a chronic condition. Remember, the condition is a chronic condition. It will not resolve on its own. It is not self-limiting. It will require treatment to manage the pain. Remember about the compression of the trigeminal nerve by that blood vessel. Remember that artery? Yeah. And also the other modalities of treatment targeting the trigeminal nerve, especially those stereotactic, radio frequency, whatever those are, the major intracranial surgery. Again, those are intended to remove the aggravating structure that's causing pressure into the trigeminal nerve. It's not self-limiting. So our correct answer here is letter C. The patient should be assessed for multiple sclerosis. Again, I think this would be our last test question of the day, number 20. After a glycerol rhizotomy procedure for trigeminal neuralgia, what should the nurse assess to evaluate the effectiveness of the treatment? Is it A, whether the patient performs daily facial exercises? B, if the patient is using an eye shield during the night? Letter C, the patient's involvement in social activities. D, if the patient avoids chewing on the affected side of the mouth. Glycerol rhizotomy procedure for trigeminal neuralgia. So what you should do to evaluate the effectiveness of the procedure. Will that be A, will that be B, or C, or D? What is your answer here? Our last item of the day. Remember, guys, that this is a drug, that medication that will actually cause relief of the pain. It will treat directly the trigeminal nerve. Number 20, let me go back into that photo. Glycerol, remember this? The drug is going to be directly injected through the advancement of the needle. It is going to eliminate the pain because the medication, the glycerol, is to target exactly the trigeminal nerve. Remember that they're going to have sedation, anesthesia, light anesthesia to promote comfort during the procedure. They will also have maybe local anesthesia. The patient will have the insertion of the needle. It will be threaded into the skin through the neck area. It could be the jaw. It is going to be guided by X-ray. And that viscous fluid is going to irritate the trigeminal nerve, which is right here. It will disrupt the nerve function, so it will reduce the pain. It will reduce the pain. So what will be your expectation after the patient has had the procedure? What do you think? Let's go back to the last question. Side effects, swelling and bruising. But the question here is the effectiveness of the treatment. The ultimate goal of the treatment. Remember about the restrictions that they have in a patient with a TN. There is decreased nutrition, right? Because of the painful sensations whenever they start eating or drinking. What about the interactions with other people? Remember this one? They will avoid conversation. And take note about the question, effectiveness of the treatment. Conversation and social activities. Remember, I said something about being aloof because they cannot really engage in conversation. So the correct answer here, guys, is letter C. That is the ultimate answer. That is the measure that the patient really is getting the desired effect of the treatment. They will now involve in social activities because there is now much better pain control after the treatment. Alrighty? Yeah, letter C. That's the correct answer. Remember about the limitations in patient. This is very huge, guys. Don't forget this. Trigeminal neuralgia, because of their fear of having the pain when they eat or drink, so they will be prone to developing malnutrition, dehydration. Another is they're going to be aloof. They will avoid interactions with people, socializations, because they're just afraid that they will not be able to converse to them. So they will just be aloof. They will not be joining those social gatherings. Yeah. Isolation. Yeah, that's I was trying to say here. Isolation from social activities. We are being asked about effectiveness of the treatment. Yes, that's true, Melrose. Oh yeah. If you had answered letter A, whether the patient performs daily facial activities, it's not related to the success of the glycerol rhizotomy. Since we are really promoting the pain control, that's not what the ultimate goal is. It's not about being able to perform daily facial exercises. Was there really a need to do facial exercises in the first place? Nope. That's not the desired goal. Not the desired goal. What about letter B? If the patient is using an eye during the night, was there an issue? Nope. Not the desired goal as well. Similar to that. If the patient avoids chewing on the affected side of the mouth, well, that simply means that they are not getting the therapeutic effect of the procedure. This simply means there's no therapeutic effect. So we are eliminating letter D as well, right? We are being asked about the effectiveness of the treatment. Okay, dokie. I think I have one more. Oh yeah, there's one more. Let's just finish this up. For a patient dealing with pain from trigeminal neuralgia, which intervention should the nurse include in their care plan? Is it A, evaluate the patient's fluid and food consumption? B, use ice packs on the affected area for 20 minutes? C, teach the patient techniques to relax facial muscles. And I believe this has already been tackled, right? I guess so. Oh yeah, I think we have dealt with this one. So we have completed this. All right. Thank you, guys. I really appreciate your attendance today. And then again, I'll see you again tomorrow for a next session. And again, we are encouraging you to enroll to our NCLEX program. Please drop by our website, stancoastnclexcoaching.com, and click on the description box below for the link. We have upgraded our library. And yeah, don't forget to like and subscribe our channel, like this video, share this to your friends. I've seen that you're not really enjoying the discussion, I guess, because there's only 31 likes. And I'm seeing that there's like 300 or even 700 views. So I just don't get it. But anyhow, if you find this video helpful in your preparation for the NCLEX, please like this video. I'm confused. Number 1 and 4 questions. Number 1 and 4? Let me go back to that 1 and 4 questions. This one? Tiramaj? I'm confused. Number 1 and 4 questions. A 55-year-old. This is basically is this asking you about the characteristics of the disease? What are those true characteristics of a patient having the TN? So we had answered letter A as a false statement. It is not a bilateral involvement. Even though there is bilateral involvement in multiple sclerosis type associated trigeminal neuralgia, this is not common to the classic type of trigeminal neuralgia. That is why this is eliminated. Okay, C is not answer. The pain typically involves the ophthalmic branch of the trigeminal nerve. This is one of the, no, not just maxillary, but it will involve the 3 branches. Remember about the 3 branches? It doesn't just involve the ophthalmic, but it will involve the 3 branches. But then again, it didn't say that it was isolated only to the ophthalmic nerve. It can affect the 3 branches: ophthalmic, maxillary, and mandibular. The option in letter, what was that option? Let me go back. Option in letter C, the pain typically involves the ophthalmic branch of the trigeminal nerve, which is correct, right? It did not say isolated to the ophthalmic branch. Yeah, so this is considered correct. Letter D, anticonvulsant medications are the first line treatment. Yes, as we have discussed, those are the primary first line medications, right? Electric pain is maxillary. Electric shock. Okay. The right cheek. It is localized. The pain is localized in her right cheek. But take a look here, guys. Given the presentation, which of the following characters are considered for true to this patient? Again, when you have a patient that has the trigeminal nerve, it is not just isolated to just one nerve. There are 3 branches, and these are all going to be affected. Even though they are complaining of electric shock, it is only not specific to the maxillary. It is also going to affect the other nerves. All right? Not just isolated to the maxillary. It can also be felt in the other branches, those other muscles innervated by the other nerves. All right? So what else? You have a question regarding number 4. What should a nurse do to avoid triggering a pain attack for a patient with tic douloureux? The correct answer here is letter A. Avoid creating drafts by moving swiftly near the patient. What was your... is there a confusion regarding the option here? You are asked about those activities that should be avoided by the nurse taking care on this patient. Remember, we should not be applying any massage to the face. That is 1. Letter C, stop oral hygiene completely. This is wrong. They can still do their own oral hygiene using the oral rinses, using a soft bristled toothbrush, not doing it vigorously. Letter B, keep the patient lying face down. Remember that the face in contact with the bed surface or the mattress, this can trigger the pain. So this will be avoided as well, should be prevented. There's no other option but to avoid creating drafts. You should not be, what do you call this? Creating this draft when you are near the patient, when you are going to be facing, or when you are going to leave the patient while you are, after talking to the patient, you should avoid this action. At least you have to back up slowly in order to avoid this draft. Okay, so this is one of those triggers in the attack. All right, so I hope that you are understanding the rationales about the item number 1 and number 4. And again, guys, thank you for attending the session, and I hope to see you again tomorrow. And wish you all the best in your examination in the NCLEX. And I'll see you again. You all take care. Bye-bye.